What started as a routine hearing quickly turned into a heated confrontation. Haley Stevens comes out swinging, directly challenging Robert F. Kennedy Jr. over rising measles cases, vaccine decisions, and public health policy.
Has expired. I now recognize the gentlelady from Michigan, Ms. Stevens.
Well, thank you, Mr. Chair, for holding this hearing, and Mr. Secretary, it is in fact true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest level since 1991. Last year, we had over 2,200 cases in America. 3 people died, 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
the same
office.
time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know
That
now that
particular
over
version.
90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to
You
the
think
CDC,
we should have given
it
a
is.
dangerous vaccine that all the science
In just
said?
the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
According
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%. And in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every
The
major
Americans- the
international
America's
health
Poison
organization
Centers,
recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions
These
that
vaccines
have not been safety
have saved
tested?
countless lives. A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage.
You're just making
Devastated
stuff
rural
up.
hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment article, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time has expired.
What begins as a standard congressional hearing quickly shifts into a tense and highly charged exchange. Haley Stevens doesn't ease into her questions. She goes straight to the point, laying out data, timelines, and consequences tied to rising measles cases. The tone is clear from the start. This isn't a routine inquiry, it's a direct challenge to leadership and decision-making at the highest level. At the center of the confrontation is Robert F. Kennedy Jr. and his stance on vaccines. Stevens connects the spike in measles cases to broader concerns about public messaging, policy decisions, and scientific credibility. Whether one agrees with her framing or not, the strategy is obvious: build a case using statistics, expert sources, and outcomes that are hard to ignore, especially when public health is on the line. But this moment isn't just about numbers, it's about trust. Trust in institutions like the CDC, trust in medical science, and trust in leadership. When those elements begin to clash, the debate becomes more than policy, it becomes personal for millions of people who rely on clear, consistent guidance. That's why the exchange feels so intense. It reflects a larger national divide over how health decisions are made and communicated. The discussion also highlights a deeper tension between skepticism and established science. On one side, there's concern about safety, transparency, and questioning authority. On the other, there's the weight of decades of research, data, and medical consensus. When those perspectives collide in a public setting like this, the result is exactly what we see here: sharp exchanges, strong language, and very little middle ground. By the end, Stevens escalates the moment from critique to outright accusation, calling for resignation and accountability. That's a significant leap, and it underscores just how serious she believes the situation is. Whether viewers see this as justified or excessive, one thing is certain: this exchange forces a conversation that goes far beyond one hearing. It raises fundamental questions about leadership, responsibility, and the direction of public health in the country.